Hi guys! Aging happens to all of us, and seeing how Singapore is facing an aging population issue, did you know that by the year 2030, 1 in 4 Singaporeans will be above the age of 65? Which is why today I'm at St. Luke's Hospital to understand what it is like to be in a community hospital. St. Luke's Hospital is a healthcare provider dedicated to enriching lives in the community through clinical, social and pastoral care.
Hello.
Oh, hello!
Hi, I'm staff nurse Tiffany, working here at St. Luke's Hospital. Within our facility, we oversee a range of services, including an outpatient clinic and 10 inpatient wards that are dedicated to specialties like wound, dementia, and palliative care. I'm currently based in an inpatient ward, but I work with other healthcare professionals in a multidisciplinary setting.
In an acute hospital setting, the pace of care can be quite fast, mainly because of the acute phases of the patient's healthcare issues. Hence, the turnover rates of patients are just as fast. The focus is on saving the patient's life, getting them well enough so that they can be discharged. Whereas in a community hospital like St. Luke's, the goal for most of the patients here is to learn to cope and manage their current conditions.
Usually most of our patients here have a longer hospitalization stay, but that allows me to form a meaningful connection with them and be a positive influence beyond just the physical aspects. Come, let me show you where I usually work.
Okay.
So I generally work in a place like this.
Ooh. But what do you do here?
So I generally be taking care of patients, making sure that they are okay, monitoring them, attending to their needs, giving them medications, doing their dressings, things like that amongst others. Actually, talking with patients can be really fun too.
Can I try?
Sure, I have this really friendly uncle. Let's go have a talk with him.
Okay. Uncle, I'm coming to see you.
This is Uncle Peter. I'd like for you to speak to him in dialect.
Yeah.
You can ask him 4 things. How's he today? If he's in pain, what's his favorite food and what he would like to eat today.
Okay, I'll try.
加油!
Hello, Uncle.
Hello.
Uncle Peter. 你好不？
好
啊，你好嘛？
好
啊，日痛啊，身体痛。OK，有痛无？
啊，我的脚痛
卡。
啊，袂使行无力。
How does he call doctor? Do you need to say?
Lokun is doctor.
老官，愛看老官，愛咪？
哎，
啊！
老闆個未看我嘅。
啊，我未看。OK，你食飽未？
啊未，
你食啥物？
有啥物食咧？
啊，有啥物食啊？炒粿條啊，福建麵啊，fish soup。你食啥物？
炒粿條，
啊，炒粿條啊，嗰邊茶，
個表小弟，
嗰邊有小帶啊。啊，OK，會使，哇，OK，
感謝。
拜拜。I've always thought that nursing was more of a routine job where one just performs a fixed set of tasks, but I didn't know that one has to learn so many dialects. So, Tiffany, were there any moments that were memorable to you as a community nurse?
Definitely. I remember this one stroke elderly patient, and that left the lasting impression on me. So she was actually quite confused and disoriented when she first came in, but she was very cheerful. And then suddenly one weekend, she spoke to me in Cantonese, saying that she wanted to be let go and that she felt that she was suffering because of the pain. Slowly, she began to eat less and less and was much more unmotivated during her rehab. We began to understand that actually she was feeling like this because of her underlying cancer, which made her decide to forego further medical treatment. To be honest, it came as a surprise, because the cancer started to spread pretty rapidly after that, and then she started to deteriorate. So we decided that we would want to fulfill her last wish, and we made sure that all her support systems were in place before discharging her back home. I vividly recall on that day of her discharge, I had the opportunity to be by her side to help her change into her home clothes and send her off. And thankfully, she looked really peaceful. And I found out a little later on that she passed on peacefully at home a few hours later. It's moments like this that keeps me humble. because I realized it's not about completing the nursing tasks, but rather it's about spending time with patients and it's about being with them. This makes the nursing profession so meaningful and impactful for me.
Thank you, Tiffany, for showing us around and for sharing your story as a community nurse. I've always known that nursing is a noble profession, but to hear from you firsthand really shows your dedication and the hard work that you guys have put in. So thank you so much.
Welcome.
I'll take my leave. Bye-bye. If you like what you have seen and you're interested in becoming a community nurse like Tiffany, do check out our link in bio for more information. There are also healthcare scholarships available should you wish to start your journey down the noble profession of nursing. That's all for today. Just keep thinking!